Hello, my name is Kathleen, and this is my report on Turner Syndrome for Foundations in Early Childhood Intervention. First, I will give you an introduction to Turner Syndrome. Turner Syndrome is a disorder that occurs only in women. It is caused by a chromosomal abnormality, and it was first reported in 1938 by Dr. Henry Turner. 1 in every 2,000 females is born with Turner syndrome, but it's also important to note that this disorder accounts for 10% of all miscarriages. It is also important to remember that the characteristics of this disorder vary for each individual. First, I will talk about the physical characteristics of individuals with Turner syndrome. The first of these characteristics is short stature, with the average height of an adult being 4 foot 8 inches. Teenage girls with Turner syndrome are recommended to have hormone therapy in their teenage years so that they can grow taller and develop secondary sex characteristics. As you can see on this page, I included a chart which shows the growth of individuals with Turner syndrome, which is shorter than that of the general population. It's also important to note that 90% of women with Turner syndrome have ovarian failure, and infertility occurs in the majority of cases. This slide features other characteristics that individuals with Turner syndrome might have, which may affect the hands, face, feet, or trunk area. The picture on this slide depicts the common characteristics of Turner syndrome that were discussed on the previous slide. There are more serious health issues that women with Turner syndrome may have. For example, 1/3 of women have a heart abnormality, and 30% have a kidney abnormality. Thyroid problems are common and can be treated with a thyroid hormone, and 50 to 90% of women experience early hearing loss. Now I will discuss the cognitive development of individuals with Turner syndrome. The average IQ of a person with Turner syndrome is 90 to 95, which fits within the typical range of the general population. However, these individuals may have difficulties with visual spatial tasks, reading, and mathematics. Some of these difficulties may involve nonverbal memory and attention. Individuals may have a slower processing speed and difficulty comprehending. However, individuals with Turner syndrome typically have strong verbal skills, and vocabulary is also an area of strength. Now I will discuss the social development of individuals with Turner syndrome. These individuals may have a delayed social maturity. A speculated cause is that their atypical appearance hinders interaction with peers. It has also been reported that individuals with Turner syndrome may lack subtle social awareness skills such as reading faces. Additionally, a higher rate of behavioral problems have been reported in individuals with Turner syndrome, such as hyperactivity, depression, and loneliness. Conversely, Rovit found in a study that adolescents with Turner syndrome consider themselves to be intelligent, well-behaved, and having a normal appearance. So there still needs to be more research done in this area. Turner syndrome has a significant impact on a family, and there are important considerations for families to keep in mind. First of all, families should be made aware that individuals with Turner syndrome and other chromosomal abnormalities have the right to special education services under IDEA. This holds true even if there is currently no delay present. Families should also be aware that abnormalities of the heart, kidney, thyroid, and ear may require special medical attention. Families should also understand that teenagers with Turner syndrome are suggested to have hormonal replacement therapy when they go through puberty, which may continue into adulthood. This allows the women to continue to grow and develop secondary sex characteristics. Because of the associated medical issues with Turner syndrome, it's important that families have medical insurance so that they can afford appropriate care to their daughters. Families should also know that when they are feeling overwhelmed, there are support groups for individuals with Turner syndrome and their families that provide help and guidance. Now I will provide an overview of the cause of Turner syndrome. There are 3 possible causes of Turner syndrome, all which occur prenatally. The first of these causes occurs 50 to 55% of the time when one of the 2 X chromosomes is completely absent. In these cases, the symptoms of Turner syndrome are the most severe. It's important to note that 98 to 99% of fetuses that have a missing sex chromosome spontaneously abort, which is in comparison to 15% of all fetuses that spontaneously abort. The second cause of Turner syndrome occurs 12 to 20% of the time, which is when one of the X chromosomes is partially missing. When more deletions occur, the more characteristics of Turner syndrome develop. The third cause of Turner syndrome occurs 30% of the time, where a mosaic pattern occurs in the cells, where a portion of cells have a missing X chromosome and the rest do not. If only a small amount of cells are impacted, then the characteristics of Turner syndrome may be very mild. It's very important to remember that Turner syndrome is not considered to be familial, and it affects women from all over the world equally. There are also no known environmental hazards or toxins associated with Turner syndrome. Now I will discuss the educational implications associated with Turner syndrome. Possible IFSP goals for individuals with Turner syndrome may involve social skill development. This can be done through modeling and reinforcing social skills. Because some individuals have difficulty attending, goals relating to increased attention may be necessary. As discussed earlier, many of the difficulties that individuals with Turner syndrome face in school relate to academic tasks. For this reason, the IEP goals of a student may be much different than the IFSP goals that she formerly had. An example of an IEP goal is increased processing time for reading and mathematics tasks. For example, students may need extra time for assignments involving reading or problem solving, and they can work towards minimizing this extra time that they need. Another helpful goal would be increased comprehension. And as stated in the section about IFSPs, social skill development is very important, and a possible intervention that could meet this goal could be peer-mediated intervention. I have compiled a list of helpful resources for families and practitioners regarding Turner syndrome. The first of these helpful resources is the Turner Syndrome Society. This large organization provides information, resources, outreach, and support for people with Turner syndrome and those affected by it. Their website features a document entitled A Guide for Families, which gives a descriptive overview of Turner syndrome and provides resources for families of children with Turner syndrome. The Turner Syndrome Society has a local chapter in Ohio called the Southwest Ohio Turner Syndrome Chapter. And this chapter provides support all over Ohio and to neighboring states. And the chapter hosts social events, a summer camp, and also features current information about upcoming research. The National Institutes of Health provides a very informative website that features both the genetic and clinical features of Turner syndrome and also provides details about upcoming clinical trials and studies. The website Moving Mountains for Kids is very family-friendly and provides insight from a mother of a child with special needs about dealing with Turner syndrome, using growth hormones, and what characteristics to expect. The last helpful resource is a news video on YouTube that stresses the importance of early intervention for individuals with Turner syndrome and also features a story about an adult with Turner syndrome who adopted a child with Turner syndrome. Thank you for your time.